neonatal sepsis. Is it clear? And then the patient has neonatal jaundice from this sepsis. The question that you have to ask yourself is, how is neonatal sepsis and neonatal jaundice related? So I'm going to explain now the mechanism of the relation of neonatal sepsis and neonatal jaundice. Is it clear? Now, you need to know that for you to have neonatal jaundice from neonatal sepsis, there is a process called the hemolytic process. Is it clear? There's a process called the hemolytic process. Is it clear? And this hemolytic process occurs because of a bacteremia. Since there is blood, there is a bacteria or a septicemia. Since there are bacteria inside the bloodstream which are proliferating, is it clear? What happens is that the spleen, is it clear, or the endoreticular system is going to break up everything inside the bloodstream, including even the neutrophils and the red blood cells. Is it clear? So when it's going to break up everything inside the neutrophil, it's going to result to what is going to call a hemolysis. You can have an extravascular hemolysis occurring from that. And that extravascular hemolysis is going to be a reason why you can have also anemia in the case of a patient that has neonatal sepsis. The conjunctiva may be pale. Is it clear? If you have anemia in the case of neonatal sepsis, neonatal jaundice, you think of a hemolytic process. You are going to have a splenomegaly and a hepatomegaly. Generally, children have splenomegaly and hepatomegaly. Is it clear? But if the spleen is much more enlarged in neonates, you can think also of the extravascular hemolysis that occurs as a result of the infectious process inside the bloodstream. Is it clear? So you are going at the beginning, when the full blood count is going to come out, you are going to have what is going to be called a normocytic normochromic anemia. You're going to have a normocytic normochromic anemia that comes from the full blood count. Is it clear? Normocytic normochromic anemia shows you that there is a hemolytic process. Is it clear? Now, after hemolysis occurring for a long period of time, when you are going to have hemolysis that is going to occur for a long period of time, you will not have again normocytic normochromic anemia, but you instead have macrocytic hyperchromic anemia. Is it clear? And the reason why you are going to have macrocytic hyperchromic anemia is because of a consumptive vitamin B12 deficiency. Is it clear? Vitamin B12 deficiency. How is that consumptive vitamin B12 deficiency occurring? You need to know that generally the first reason why you have consumptive vitamin B12 deficiency is that generally in children you have lack of storage of vitamin B12. The liver is not yet mature to store enough vitamin B12. So when you have to store enough vitamin B12, when you have an increased proliferative action like hemolysis, is going to result in vitamin B12 deficiency in children. That's the first reason why the child is going to be prone to a macrocytic hyperchromic anemia. The second reason why you can have a consumptive vitamin B12 deficiency is that the more you have hemolysis, the more there's going to be compensatory production of reticulocytes. And you need to know that the compensatory production of the reticulocyte is going to use now vitamin B12 for the formation of the nucleus and the DNA. Is it clear? Since there is going to be more consumption of the vitamin B12, you are not going to have vitamin B12 deficiency, and you are going to have a macrocytic hyperchromic anemia. Is it clear? Now, if you have a bloodstream that you have both macrocytosis and you have normocytosis, that's normocytic cells, and you have macrocytic cells, you have an element on the full blood count, which is the red cell distribution rate. Is it clear? There are two red cell distribution rates. You have the red cell distribution rate for the chromia, red cell distribution rate for the chromia. Is it clear? And you have the red cell distribution rate for the cell size. Is it clear? When you have normocytic and macrocytic anemia, you see that you're going to have different sizes of red blood cells. So you go on that full blood count, you are going to see that the red cell distribution rate of the sizes of the red blood cell is going to be increased. It is increased because there is anisococytosis, that is different sizes of red blood cells. Is it clear? Now, if you want to visualize the difference in the chromasia, that is the difference in the colorization of the red blood cell, you can use now the red cell distribution rate of the chrome ledger, which is when in this case you have a normochromic anemia and you have hyperchromic anemia. Since there's a different chromization of the blood cells, you are going to have an increase in the red cell distribution rate of the chromasia. Is it clear? Which is also called polychromasia. Basically, when you have polychromasia, it's different colorization of the red blood cell. And when you have anisococytosis, you have different size of red blood cell. And then the last one, you have the different shape of the red blood cell, which is called poikilocytosis, and it's also visualized with another element on the full blood count that I'm going to explain later on the tutorial of full blood count. So that is those are the things that you have to visualize when you have a patient that has neonatal sepsis. Now, the next point that you have to visualize in a patient that has neonatal sepsis, you have already visualized the physical examination. Now you are going to move now in a patient that has late onset neonatal sepsis.